All right, pharmacy students, welcome. Let's dive into a topic that's super important for university exams, dermal drug penetration. We're going to break down exactly what you need to know, sticking right to your syllabus.
So let's kick things off with a really interesting question, one that gets right to the heart of formulation. How is it possible that one cream is designed just to protect the skin, while another one can send a drug molecule deep into your bloodstream? And spoiler alert, it's not magic. It's all about the smart, calculated choices you make as a formulator. So let's figure out how we actually control that drug's journey.
Okay, first things first, let's get our definitions straight. You know, all those things like ointments, creams, and pastes, they all fall under this one big umbrella, semi-solid dosage forms. Now, they're all made for the outside of the skin, but they can have two totally different missions. One is to work locally, right there on the skin. The other is to work systemically, basically using the skin as a doorway to the rest of the body.
So, to get back to that first question, you've got to understand that not all ointments are made the same. Actually, they're designed very specifically to reach 3 different depths in the skin. And it's that depth that really dictates what the medicine does.
Okay, this breaks down into 3 key terms you absolutely have to know for your exams. First, we have epidermic action. Think epi for upon. This is all about surface action. Think of it like a shield. It's not meant to be absorbed. Next up is endodermic action, with endo meaning within. Here, the drug gets into the deeper layers of the skin. And finally, we have diadermic action. Dia means through, so this is the full-on journey, right through the skin and into your system.
So, the big question is, how do we actually control this? How do we decide if a cream is going to be epidermic, endodermic, or diadermic? Well, the answer, and you'll want to highlight this for your exam, it all comes down to one single critical ingredient: the ointment base.
And let's be super clear about this. The base isn't just some filler material. Nope, it's the vehicle. It's the gatekeeper. Honestly, choosing the right base is probably the single most important decision you'll make to control where that drug goes and how fast it gets there. All right, so let's start with the bases that are basically designed to keep the medicine sitting right there on the surface of the skin. These are what you'd reach for when all you want is a protective shield or a really localized effect. Okay, so here we've got 2 types of greasy bases to look at. First up, on the left, you have oleaginous bases. Think of things like soft paraffin. Basically, these are hydrocarbons. They're greasy, they don't mix with water, and they form this waterproof film that just blocks the drug from getting absorbed. Then, on the right, you've got absorption bases. Now, they're also greasy, but they have a secret weapon. They can actually absorb water. And that little trick allows for just enough drug absorption to get into those deeper skin layers for that endodermic effect, but it stops it from going all the way into the bloodstream. Okay, now let's flip the script and look at the bases that do the complete opposite. These are the ones you pick when you want the drug to be released, to travel deeper and to get into the system for those big systemic effects. And wow, the difference here is night and day. So on the left, you've got your oil and water emulsion bases. These are the creamy, non-greasy ones that feel nice and wash off easily with water. And that water washable part is key. It helps them release the drug really well. Then on the right, you have water-soluble bases. These are totally greaseless. What's cool is they basically dissolve using the moisture that's already in your skin, which means they release the drug super fast and efficiently. Perfect for that diadermic, systemic delivery. All right, this table right here, this is pure gold for your exams. You're going to want to screenshot this. It lays it all out perfectly, linking the base type to its key property, how it releases the drug, and what its main goal is. You can see the pattern, right? Greasy and sticky? That means the drug stays put. Water washable and greaseless? That drug is going on a journey. Okay, theory is one thing, but let's make this real. We're going to walk through 3 super clear examples, the kind of stuff you definitely see on an exam. Okay, example 1. Imagine you need to make an antiseptic ointment. The goal? It's all about protection. You want that epidermic surface level action. So what's the no-brainer choice here? Yep, an oleaginous base. That greasy waterproof layer it creates holds the antiseptic exactly where you want it, on the surface, and it stops it from getting absorbed. Okay, example 2. Now you need something to go a little deeper, like a cream for muscle pain, a counter-irritant. The goal here is an endodermic effect. This is where an absorption base is your best friend. It hits that perfect sweet spot. It lets some of the drug absorb into the skin tissues to do its job, but it puts the brakes on before it can get into the bloodstream. And for our last example, let's say the goal is to get a drug into the entire body. We're talking systemic delivery, like a transdermal anti-inflammatory. You need a diadermic effect.
For this to work, your base has to be amazing at letting go of the drug. So the clear winner is a non-greasy water wash will base, either an OW emulsion or one of those water-soluble bases we talked about. They readily release the drug, letting it pass right through the skin and into the bloodstream.
All right, time for a rapid recap. Let's lock in the absolute must-know high-yield points for your exams. Pay close attention to these next 4 points. This is the stuff you've got to know.
First up, exam point number 1. You've got to know the 3 levels of penetration. Epidermic is on the surface, endodermic is inside the skin layers, and diodermic is all the way through to the bloodstream. Exam point number 2, and this might be the most important one. The ointment base is the driver. It's the single most important factor that controls how deep that drug goes. Basically, the base you pick determines everything.
Number 3. Just connect these words in your mind. Greasy bases, like oleogenous and absorption bases, are for limiting absorption. They're designed to keep things local, on or near the surface. And exam point number 4 is just the flip side of that. Non-greasy bases, like your O/W emulsions and water-soluble bases, are all about promoting absorption. They're designed to let that drug go so it can get into the system. Okay, so to bring it all home, I want you to think about this question. Look, knowing this stuff isn't just about getting a good grade on an exam. It's fundamental to what you're going to be doing every day as a pharmacist. When you're compounding a product or even just explaining to a patient why one cream feels totally different from another, this is the knowledge that helps you provide safe and effective care. So yeah, it's a really good question to ask yourself now and for the rest of your career.